I'm Kevin Libwood, joined by Andrew Page. We're from Theogen, and this is the Bioinformatics Lab podcast. And today we're going to be discussing the Terra platform, a resource we've taken a huge liking to. It's been really a critical resource in our aim to distribute bioinformatics resources to laboratories near and far. And there's a ton to talk about it. Andrew, you've more or less recently been introduced to Terra, so I'm sure you've got a couple of questions that can kind of seed our conversation a little bit, that I can help to provide some context
Absolutely,
on.
yeah. I guess this will just be me learning about Terra and just asking you questions, that I should know
Fair.
myself. But I guess I'm more used to things like Galaxy
Yeah.
and Nextflow and on the command line or whatever. So Terra, how does it relate to public health? I thought it was more of a cancer platform.
Yeah, that's fair. And even like talking about those other resources you talked about, Galaxy, Nextflow, and I think you mentioned one other. And in your general experience, using these resources at the command line, so I think that's probably a big change worth discussing or highlighting, is that this isn't a command line tool. It's a graphic user interface. It's a web application that gives users access to bioinformatics tools. So it really focuses on the analysis side as opposed to maybe the developer side when we're thinking about really technical practitioners that are interacting with resources at the command line. And this was, I think, before we started adopting it for public health, it was primarily utilized in institutions like the NIH in the US, and in a lot of cancer genomics. A lot of the papers you'll see that highlight Terra, especially before 2020, focus on exactly this area of research, because I think in their field, similar to ours, there was a lot of practitioners who needed bioinformatics analysis, but maybe didn't have the card-carrying bioinformatics scientists in-house. And that's the exact situation a lot of public health laboratories are in. They're starting to generate these data, and they need an ability to routinely analyze these types of information without necessarily needing to be expanding their workforce or expanding their infrastructure. And most of those laboratories may not even have that option in front of them to expand their workforce, expand their infrastructure, but they still need the bioinformatics capabilities. So in some of our collaborations with the Massachusetts Department of Health, we were introduced to the Terra platform because of their collaboration with the Broad Institute. So Terra platform, developed and sustained by the Broad Institute of MIT and Harvard, along with some collaborative efforts with Microsoft and Verily Life Sciences. And it offers exactly this. It's this portal to these resources that aim for the usability, the early adoption. And, I'm not teaching somebody how to use command line tools and how to navigate a Linux directory structure. Rather, I'm showing someone how to use a website, right? So, stealing a phrase, I think this was from Chris Benton in New Hampshire, of, laboratorians, they need to know what time it is, not how the watch works. And I thought that was a perfect phrase of, they need
Yeah.
to be able to do the analysis. They don't necessarily need to know how to write the Whittle workflow or how to write the Nextflow workflow. So that's what Terra is. It's this interface that abstracts all the technical underpinnings of the CLI tools and things like that, and
So
provides that access.
Kevin, how
Please.
much does this cost?
Oh, it costs as much as the compute and data storage of the user. So to use Terra itself is zero cost. It's kind of got this model of bring your own billing account, right? And even on that front, it's relatively negligible. When you're looking at laboratories that are generating these types of data, it might be hundreds of dollars a sample, if not more, to actually generate the data. When you're looking at the compute cost for the analysis and for the data storage, I mean, it's less than $1. Right? Maybe, if you want to get in the craziest volumes of single sample data, maybe it's $2, but it's a fraction of the cost. It's pipette tips, realm of expenditures relative to what's actually
But
happening.
it is open source, isn't it?
It is open source. It's open access, so it's free to use. Everyone can utilize it. It's built off open source libraries. Actually recreating your own Terra instance may be a bit of a challenge because of how complex the coordination of things are, but it technically falls within the open source umbrella, because everything is out there and available for laboratories to
Mhm.
use. And then everything, all the workflows we make available on the platform too, they're deposited to the DocStore repository, and all of which are linked to open source public GitHub repositories. So definitely, falling in the lines of interoperability, transparency, through it from end to end of the bioinformatics process.
That's pretty awesome. Okay,
Yeah,
so as a bioinformatician, I love just going a command line and just
yeah,
bashing stuff out, you know,
yeah.
and because I know that I know I want to map some data or call some snips, I can do that very easily. But within Terra, it seems that you've just solved everything for me already, so that I now am out of a job, you know. And so why should bioinformaticians like me like this, you know?
Oh, that's a great question. We're working with a lot of public health. So most public health labs don't have a bioinformatics scientist. So even
Okay.
even even the problem you're describing is a great problem to have. What do I do with my super technically proficient individual who's in my laboratory? So for most public health labs, they don't have that problem. They just need access to the Terra platform. But for the laboratories that we work with that do have a bioinformatics scientist, it expands their capabilities, absolutely expands their capabilities, because what often happens is that one technical practitioner who can develop the workflows, they're also often the only one who has enough experience at the command line to run those workflows. So they end up becoming, or a laboratory maybe end up becoming dependent on that one technical developer who could be using their time to develop. They're actually the only ones who can also analyze. So so what it does for laboratories is it expands that individual's capabilities and that they can write the workflows. We'll teach them how to write workflows. That's often the case. Is we'll show them how exactly to string these together. As I said, our workflows are open source. You can fork ours, make the modifications you feel are relevant, and then you can put this right into the hands of the laboratory scientists that maybe not have that technical capability. So that's where we've seen it the most useful is in those institutions that also have the card carrying developers. Those developers now are free to develop the next workflow. Or also, there's always going to be the instances too that it's helpful to have a technical practitioner, in contact that you're in contact with to do sometimes the deep dive and troubleshooting. That's always going to be the nature of our job. Just given how many samples public health laboratories are processing, there's non-zero probabilities that there's going to be an error at any given time. And when you have the laboratorians that can do routine work that 99% of the time they're able to produce the reports that they need to produce, that 1% of the time you might need to contact a bioinformatics scientist to dig in, figure out what's happening. The systems are so complex at this point that it's always useful to have somebody, either an external partner or internal, who is that card carrying bioinformatics scientist that can dig in and see what exactly is happening.
So can I throw like, 1,000 SARS-CoV-2 samples at it and it'll just kind of magically work?
Yeah, that's the beauty of it. You can do exactly that because it's not, it's also, I would say it stands on the shoulders of other technical giants, innovative efforts across our field, because it's built off of, in Terra at least, the workflow engine is Cromwell, which runs WDL workflows, workflow development language workflows. And, through Cromwell and all that work, yeah, I got to remember exactly which one's which. But through Cromwell, they figured out the scaling, how to interact with GCP resources like Google Life Sciences and all the like, to make that scalability possible. Everything that we're used to on the command line, that is already sort of embedded as a feature of Terra in and of itself. So you can load the 1,000 samples, you can load one sample, and the Cromwell engine will figure out how to scale that, how to make the parallel processing per sample, spin up the Docker images independent of one another, and all of that, all abstracted away from the user. You just load the samples, you hit analysis, or you hit run, and it'll launch 1,000 in the same way it'll launch 10.
That's awesome because often, it's easy academically, to do one or two samples, but when you try and do
Yeah.
10,000, everything goes to hell. You break everything.
And that was a big thing too, is that for a lot of laboratories, as I was mentioning, there was no bioinformatics infrastructure. They didn't even have the Linux laptop that sometimes laboratories are dependent on. They didn't have anything. They were only given the ability to generate the sequencing data, and then there was a lot of laboratories like, okay, now what? And then what Terra offers is not only that user interface, but because it's based on GCP and then also now Azure, you have an infrastructure, a scalable infrastructure now at your disposal. And that's what happens in public health. Maybe you have something a week or two, it's 2 or 3 or 10 samples, but then in a pandemic, you're looking at thousands of samples per week, and even just in outbreak events, if there's something critical happening, you're going to see that surge in sequencing volume you need something that's also dynamically scalable to meet the surge capacity computationally for the analysis. And that's what Terra offers as well. You can scale up and scale down as needed.
That's mad. Like in my previous role, like I had to plan like a year in advance, year and a half in advance to get money to then go
Yeah.
and uh buy hardware, get it commissioned. It will be an 18-month process. You'd be thinking, how many terabytes do I want? How much compute do I want? What do I
Yeah.
need then for the next 5 years? So you'd be buying years and years and years and years in advance and estimating. And just,
Yeah.
you nearly be making up numbers at that point. What was the curve been like before and what's the curve going to be like now?
Yeah.
And just getting physical hardware on site takes forever. And then you have all the extra things, is there enough cooling in this room? Is there
Yeah.
enough electricity going to the racks? And all these other complications. And to be able to just kind of slap a credit card down and, click go is yeah, pretty awesome.
It's a nice advancement of the technologies. And so when laboratories are building their bioinformatics infrastructure, there's some laboratories that have extant HPCs and they get to use that that's already at their disposal, and they've already solved a lot of those problems. But for laboratories that have not gone through that process of procurement, trying to predict how much compute they'll need, and in that case too, you kind of have to build to the maximum capacity, so it can
Yeah.
cost an insane amount, and then let alone the real estate, the personnel, the cooling, all these other pieces of
But you
infrastructure.
know what's even worse? Like
Hmm,
government will have money at times you don't need it. So they'll have plenty
yeah,
of money coming up to maybe up to the end of a billing period,
yeah.
budget period. And you have to take it while it's available because next year there
Yes,
may not be no money. And so you might be refreshing stuff maybe a year or two earlier than you need to. You might know
yeah.
this hardware can last 7 years if it needs to, but actually you might refresh it at 4 years. And it's just,
Yeah.
it's a really inefficient way of doing things.
And we can spend episode on episode talking about government funding cycles and the limitations and restrictions people are under. Because I was put in that position too, in Virginia. But digressing there, this
Yeah.
helps to solve that infrastructure problem quite solidly, and it helps the people transition to the cloud in a really accessible way. Because to transition your infrastructure to the cloud without something like Terra, it's like we're not even talking about bioinformatics technical practitioners. You're talking about cloud technical practitioners, architects, people who are well versed in GCP or Azure, AWS. Yeah, exactly. Wildly
Expensive,
expensive.
yeah.
So Cromwell, or rather the Broad Institute, they have a massive team of developers in their data science platform, DSP, or data science program, I believe, who've already put in a lot of the hard work, who've consolidated a lot of the efforts, then distributed the resource as a tool. So we lean on that. We take advantage of all the advancements they've made in the field, and it's been fruitful. At this point, we've worked with hundreds of laboratories. I think in our last estimates, it was right under 100. Over 90 public health laboratories have adopted Terra as a platform for bioinformatics analysis, doing millions of analyses a year using these open source workflows. And I talk about that, not in no way trying to be a pat on the back of like what we've done in all these things, but really just highlighting how this works. This is a model that undeniably is helpful for laboratories to gain access to bioinformatics software. And I've talked about this when I was at GMI, but and even in an MGen article we published, talking about Terra's use, utility in public health, that Terra works because Terra is an idea brought to fruition, and that idea of this open bioinformatics ecosystem, that a term coined by Ali Black in her Nature Communications article, but I think is so apt because it hits all those required elements of pathogen genomics resources, in that it is an easy to use portal to access these bioinformatics resources. We are built off a registry of containerized workflows through DocStore, and then this ability to transfer different results from infrastructure to infrastructure. Because it's on the cloud, export of these reports become all that much more manageable. We can standardize everything. And so we're seeing the success of Terra because I think of how well it aligns to this idea of an open bioinformatics ecosystem.
And just to clarify, this is not an advert for Theogen. You can
No.
just get your credit card, set up a Google billing account, and then sign up yourself, if you're in, say, public health. and that's it. You can watch free online videos and whatnot to learn how to do it. You don't need to hire a company like us. Sorry, Kevin.
No,
Um,
no,
but
absolutely.
it,
No,
it
I
is
think
all
that's,
free
don't
and
tell
public domain.
Greg.
It's all open source. Like it's a good ethos to have, and all you need is your billing count.
Yeah, because Theogen, we're an industry partner there, but man, we came from public health, so we understand. Yeah, our ethos is built off of people who live in public health, who are born. My career was born in public health, so that is our mission, and that's often we get pumped when we see laboratories adopt this without even our intervention. There are many laboratories out there that are using these workflows that have never communicated to us. And maybe we'll meet them at a conference or something like, hey, man, we're using Theoproc on Terra. We've seen your videos online. It's like, that's what we've been aiming for. So yeah, Terra's been an incredible tool. Hats off to our collaborators at DSP, Broad Institute, Microsoft, and all the like, who've put in the hard work and have been really responsive to a lot of the feedback we've been able to relay from the public health community and act and change the UI accordingly.
Well, thank you very much for the conversation, Kevin. I'm sure we'll talk about Terra more throughout the podcast episodes, and we'll call it a day there.
Absolutely. And if people are interested in learning more, though, we do have that article, Accelerating Bioinformatics and Public Health Pathogen Genomics in Microbial Genomics, describing exactly this.